Welcome to the last lecture on the nursing process. In this lecture, we'll go over implementation and evaluation, which are the last two phases of ADPI in the nursing process. Nurses and other members of the interdisciplinary healthcare team provide care through interventions designed to promote, maintain, or restore a patient's health during the implementation phase of the nursing process. These interventions may be direct or indirect activities, or they can be independent or dependent nursing actions. Each intervention is included in the patient-centered plan of care to support the patient's goals identified during the planning process. You'll hear that in nursing, we always apply evidence-based nursing practice, meaning that we are providing interventions to the patient that are evidence-based or research-proven items that will help to make the patient get better sooner. There are many different references and available resources to nurses, including the CDC, NIH, AHRQ, and other research databases, including Joanna Briggs, CINAHL, and the Cochrane Review, that help provide nurses with current evidence-based practice research and applications. We can provide direct patient care. Direct care interventions include cleaning an incision, administering an injection, and ambulating the patient. Some direct care interventions must be carried out by a registered nurse, but others can be delegated to another care provider, such as an unlicensed assistance personnel, with proper training and supervision by the nurse. Safe practice alert. Before implementing any intervention on a patient, the nurse must check the patient's identity using a minimum of 2 methods. This is done by asking the patient's name and date of birth, and if you're in the VA setting, we'll ask for the patient's name and their Social Security number. This is a critical safety step that helps prevent interventions from being performed on the wrong person. One form of direct care that's ongoing throughout all stages of the nursing process is reassessment. At the beginning of your shift, you'll perform a head-to-toe assessment, and then reassessment begins and does not end until you leave for your shift. This need for continual patient reassessment underscores the dynamic nature of the nursing process and is crucial to providing essential care. Activities of daily living, or ADLs, include tasks that are undertaken on a regular basis: eating, dressing, bathing, toileting, and ambulation. Because patients perform ADLs at different levels, it's important for the nurse to assess whether deficits exist and to determine whether patients need short-term or long-term interventions to address their needs. Many interventions focus on physical care that's performed when treating patients. These interventions may include invasive procedures such as starting an IV or inserting a catheter, or they could be non-invasive, such as administering medications and repositioning. In some cases, nurses provide support and intervene with patients through informal counseling. Counseling is a process through which individuals use professional guidance to address personal conflicts and emotional problems. Teaching is an essential professional nursing intervention. Each interaction with a patient is an opportunity to teach. The nurse must keep in mind the best way that the patient learns, the patient's educational level, the cultural considerations, the potential communication barriers. Readiness to learn is also an important consideration. Another teaching plan consideration is whether to involve the family and the care providers in the teaching process. When nurses provide patients and families with opportunities to ask questions and comprehend healthcare information, they become an integral portion or part of the healthcare process. Indirect care. These activities assist in providing comprehensive care to patients, although they may not be obvious to the patient. Effective communication and collaboration regarding patient care are essential for patient safety and positive patient outcomes. Referrals in healthcare involve sending a patient to another member of the interdisciplinary team for a consultation for their services. The best methods in treating patients for a variety of signs and symptoms are researched and then implemented into practice. As resources for patient care become increasingly limited, nurse advocacy is critical in ensuring patient access to needed services. Delegation is the transfer of responsibility for performing a task to another person while the nurse who delegated the task still remains accountable. Prevention-oriented interventions. These interventions influence patient outcomes. Some examples are cleansing an incision is a nursing intervention that can help prevent infection. Educating a patient about a risk factor modification for cardiovascular disease may prevent future myocardial infarction. Placing infants on their back to sleep may reduce sudden infant death syndrome. There are several diversity considerations the nurse must consider when developing a plan of care for their patient. For lifespan, interventions must always be age or developmental level appropriate. Older individuals with cognitive deficits may require care that would typically be provided only for children or adults with physical disabilities. Encouraging patients of all ages to actively participate in their care provides them with a sense of control, even in the most serious circumstances. For gender, identify gender roles that may affect care delivery. Some patients may prefer nurses of the same gender. This preference may stem from generational norms, personal comfort, or cultural considerations. Culture, ethnicity, and religion. Culture plays an important role in communication with patients. Professional interpretation services should be implemented when detailed care information needs to be shared. It's important to know whether eye contact or physical contact should be avoided. Proper explanation of all procedures is essential for individuals of all cultures. Asking patients to share their understanding of a procedure that has just been explained is a valuable way to verify the communication has been successful. Some interventions may be declined because of religious affiliation, including blood transfusions. Disability. Interventions must be individualized for each patient and adapt to any limitations, including amputations, learning disabilities, blindness, and deafness. Morphology. The nurse must ensure safe practice in relation to body size and should seek additional support or equipment when necessary. Collaboration among healthcare team members sometimes results in the nurse delegating some aspect of patient care to unlicensed assisted personnel. The National Council for State Boards of Nursing has provided the 5 rights of delegation to support safe delegation of care. The right task. Is this a task that can and should be delegated? The right circumstance. Is this appropriate at this time with what's going on? The right person. Does this person have the skills, scope of practice, understanding, and expertise to perform this task? The right direction or communication. Has the proper information about what the task needs to be completed been shared so that what needs to be done is clear? The right supervision or evaluation. Has the nurse followed up to ensure that the care was adequate to meet the needs of the patient? Patient education and healthcare literacy is also very important. One example is educating patients regarding their role to monitor hand washing by healthcare personnel to increase compliance with reduced hospital-acquired infections. Another way to provide education to your patient is through written information. So written brochures will help to instruct the patient, will not only reinforce their learning when you're going through it with them, but it'll leave them with printed information that will help to back up what you've told them. Independent nursing interventions are tasks that the nurse performs and may perform without a physician or primary care provider order. Repositioning a patient in bed, performing oral hygiene, providing emotional support through active listening are examples of some of these independent nursing interventions. Safe nursing practice requires that the nurse knows how to perform these interventions before the intervention is implemented. Whether the initiation of independently chosen interventions are permitted in their practice setting. The extent to which the nurse can implement independent nursing interventions is often determined by the area in which the care takes place. For instance, community nurses who work in an international field hospital may have the authority to initiate interventions traditionally reserved for other healthcare professionals in the formal inpatient setting. Dependent nursing interventions are tasks that the nurse undertakes that are within the nurse's scope of practice, but require an order of the primary care provider before these can be implemented. Dependent nursing interventions require nurses pay strict attention to detail of what was ordered and recognize when implementing a dependent nursing intervention is appropriate or should be withheld. Administering patient medications or administering oxygen to the patient are examples of common dependent nursing interventions that require clinical judgment before implementation. These interventions are based on collaborative effort with the nurse and the physician to provide care to the patients. For medication administration, the nurse checks the primary care provider order, the patient's allergy, the expiration date of the medication to be administered, and then addresses the 5 medication rights prior to medication administration. All forms of prescription medication require an order before administration, as does providing oxygen to the patient. For medical treatment, nurses must use sound clinical judgment to perform interventions and seek clarification as needed. The patient may have standing orders written on their chart by their primary care provider that can help explain independent and dependent nursing interventions. All interventions that are performed by nurses and other healthcare personnel need to be documented. If a nurse does not document the medication that was administered, for example, a patient may receive an additional dose of that same medication. If completion of patient orders is not documented, for example, if laboratory results were not reported and the patient needs to have another blood draw, the patient may be adversely affected medically and financially, as a repeated blood draw could be painful and also costly. Within HIPAA, or the Health Insurance Portability and Accountability Act guidelines, patient documentation is provided to insurance companies and other billing for reimbursement. Evaluation is the final step in the nursing process. This step focuses on the patient and the patient's response to the nursing interventions that were performed to see if the patient was able to have goal attainment based on these interventions. Information on the effectiveness of nursing interventions is a byproduct of the evaluation process. During the evaluation phase, nurses use critical thinking to determine whether the patient's short and long-term goals were met and whether desired outcomes were achieved. Monitoring whether the patient's goals were attained is collaborative, including the patient in the decision-making process. Goal attainment and the plan of care. Did the patient achieve the goal that was set? Each nursing care plan is tailored to meet the specific needs of a patient. For example, a patient may have a nursing diagnosis of acute pain after a motor vehicle accident. The goal for the patient is to report a pain level of less than 6 out of 10 during the nurse's shift. Nursing interventions include pain assessment, administering analgesic medication, repositioning the patient, distracting the patient, providing a quiet environment, and giving the patient an opportunity to share his concerns. The patient consistently rates his pain at an 8 out of 10 for the entire shift. In this case, evaluation reveals that the patient's goal was unmet and that a revision of the patient-centered plan of care is required to more effectively address his needs. When a patient's goal is unmet or only partially met, the plan of care may need to be revised or adapted to support goal attainment. Patients may develop complications like a deep vein thrombosis or a DVT that limit the ability to ambulate 4 times each day, making a goal of increased ambulation unattainable. When complications arise or patient goals are only partially met, the nurse revises a plan of care in response to the evaluation findings. There are several decisions being made in the evaluation process: continuation, adaptation, or revision to the plan of care. Evaluation of the patient's goal or outcome can be positive when the patient's goal is met and the problem is resolved. When this happens, the nurse needs to determine whether the patient's plan of care needs to be continued, adapted, or revised. Such decisions are made based on clinical judgment. Goal attainment is one reason that plans of care are discontinued. Another is changing circumstances. If the goal was for the patient to demonstrate proper injection of enoxaparin or Lovenox prior to discharge, and the patient did so safely and accurately for 3 consecutive injections, the outcome has been met. However, if the goal was for the patient to ambulate 3 times daily without assistance, but the patient became unresponsive due to a cerebral vascular accident or a stroke, the ambulation goal is no longer realistic or appropriate, and this aspect of the plan of care should be discontinued. If the patient's goals are not achieved, the nurse reflects on questions. Reassessment should occur every time the nurse interacts with the patient or reviews updated diagnostic laboratory or test results. The nurse must continually monitor for changes in the patient's condition that affect the patient's plan of care. The Joint Commission requires patient care plans be evaluated on a continual basis. In many agencies, nurses are required to evaluate patient outcomes at least once during every shift. Making modifications to plans of care as the patient's status changes is a necessary component of providing safe patient care. As a patient-centered plan of care changes, new goals are developed. After new goals are formulated, additional interventions are developed and implemented to assist the patient in achieving them. The patient care plan remains the cornerstone of nursing care. Evaluation is the means by which the nurse determines the care plan's effectiveness in meeting the patient's needs. Quality improvement is a performance-based approach of looking at patient treatment outcomes and determining what could possibly be done differently. We may look for new evidence and for evidence-based practice to try to find new ways or interventions to improve patient care that will help to ultimately improve patient outcomes. For this class, you will have 2 assignments of a functional dimension care plan for your formative and summative evaluations. Each section of your care plan covers a different functional dimension for your patient. You will be placing these boxes in the priority of order for your patient according to their needs. You will be required to complete the entire box for your highest priority and the first 5 items in all the other boxes. Here is the example of the highest priority box that we completed previously in the planning stage. Here is the second part of the highest priority box that you completed in the planning stage and listed all 5 of your interventions. In this phase of the evaluation process, you will be looking at the actual outcomes for your patient when you did perform these interventions. Remember that these need to correlate. So when I'm looking at actual outcome number 1, it should be a reflection of what happened with my patient when I performed the number 1 intervention. Remember to tell me exactly what happened, not that you just performed the intervention, but that what actually happened when you did it. So in this example, assess the patient's ability to ambulate independently. I should say then, you can see the patient has an unsteady gait. I'm actually saying what happened when I did this intervention. What did I find? Finally, in the evaluation phase, we'll also be looking at a short paragraph that reviews the short and long-term goals, were they met, and if the plan needs to be revised or modified. This completes the nursing process and the cycle begins again.